Hi, I'm Catalina, a pediatric med-surg nurse, and I'm going to take you along on my 12-hour shift. The first thing I do when I get to the hospital is get a report from my day shift nurse, and when I do this, I usually go by systems and do a full head-to-toe on my patient. After that, I'll look at my orders and see what medications I have due, and I usually have 8 or 9 p.m. meds, so I'll go into our med closet and get my medication. We also have something called a Pyxis, which dispenses medications for us too, depending on what kind it is. Sometimes after medication is dispensed, I have to draw it up in a syringe to give a specific quantity. One of my patients was placed NPO, which means nothing by mouth, so I put a sign on their door. This is our supply room, which contains a bunch of different supplies that are broken up into different categories depending on what we need. I had to rotate the pulse ox on one of my patients, so I just grabbed a new one, and I was going to place her on a nasal cannula, which is a delivery method of oxygen. At 5 a.m., I got ready to do my blood draws. The supplies needed can include your tourniquet, your needle, and your blood tubes. Right before the end of my shift, I had to hang an antibiotic, which means you have to hang it as a secondary line. So here I am just priming all my lines and shaking up my antibiotic before hanging it. I also always make sure to label my lines so we know when to throw tubing away. And that was 12 hours as a pediatric nurse. I hope you enjoyed coming along on this shift with me.